5 common questions that are routinely asked in slip disc surgery. Firstly, how big is the incision? So I want to tell most of our viewers that the incision is almost this size, the size of my fingertip. It is not bigger than my fingernail. So this is the size of incision that you will get in one level slip disc surgery. Secondly, patients ask us if we are going to cut any bone or not. So the answer is no. These days, by the technique that we use, we don't cut on any bone. Rarely, sometimes if the disc is too big, we might need to create a window in the bone, but we normally do not cut the entire bone, and laminectomy is very rarely required. So almost no bone cutting happens during the surgery. Thirdly, for how long the hospital stay is required. This is the most common question that people ask us. So the answer is, if you are doing a surgery in the morning, supposing at 8 a.m., we are able to discharge you by evening, say by 7 p.m. or 8 p.m. This stay is required only for observation. The surgery itself lasts for around 40 minutes, and after that we keep the patient under observation for some time, and then we can discharge the patient. If you are doing surgery in the evening, the next day morning we discharge the patient. Fourth question that people ask us very commonly is, how much disc are we going to remove? So the answer is, we only remove the fragment of the disc that has come out and creating the trouble. We do not touch the normal disc, and we do not remove any extra tissue from the normal disc. Only the portion of the disc which is pressing the nerve, we remove that part, and the normal disc is not touched. Now, fifth question that people ask us is about the activities. Most of the time, we are able to make the patient walk on the same day. We send the patient home next day. Patient is allowed to drive a car from third day. He can walk around as much as he wants from day 1. Bending forward, lifting heavy weight is not allowed for 3 weeks. Normally, we don't need to remove any suture these days, but a dressing is required on 5th day and 10th day. And if the person wants to join gym, he can join it from around a month end. So, if you have any questions regarding slip disc surgery, feel free to contact me. Thank you. अगर आपको हमारा ये वीडियो पसंद आया तो हमारे चैनल को सब्सक्राइब करना ना भूलें और ज़्यादा से ज़्यादा शेयर करें।